Iyengar, Secretary NATHEALTH, Dr. Sudarshan, Ballai, President NATHEALTH, and Ms. Preetha Reddy, Senior Vice President NATHEALTH.
Very good afternoon to all of you. Thank you for being here, and also our apologies for the delay in getting here. The session was so interesting this afternoon, it took a little longer than expected. It was the NATHEALTH 6th Annual Summit, the theme of which was integration, collaboration and reimagination, brings the voice of healthcare ecosystem into one platform. Of course, we had the inaugural session which was attended by none other than the chief guest, Dr. Vinod Paul, member of NITI Aayog and CEO of NHA, of National Health Authority. We had a very interesting session on digital health and a lot of take-home messages from all of that. But what I would like to say now is few of the key messages which we want to convey. First and foremost, I think as you probably saw in the inaugural session, we want to be unified in our approach to healthcare. And probably for the very first time, we had leaders from different fora come together and say that we will be the unified voice of healthcare, and certainly NATHEALTH has been a catalyst. You have seen AHPI, FICCI, CII, ICC, so on and so forth coming together. I think that is a big message that we have sent. The second is, as you are aware, we are sort of working very closely with the government, because we do believe the health of the nation, neither the private sector nor the government sector alone can deliver healthcare to the nation. And unless we work together, universal health coverage for the masses is just not going to happen. The third thing which all of us, especially the providers like Dr. Preetha Reddy's group, our group and others, have something very close to the heart, is the code of ethics and ethical practice of medicine. As you can see, there's a lot of violence, vandalism, so on and so forth, and many of these are trust deficits which have caused this kind of actions by the general public. So we do believe that we should have a code of ethics. IMA, FICCI and many others have worked on this, and we at NATHEALTH would like to facilitate so that the code of ethics is followed by all the people who need to practice it. We'll have also experts in the field who can help them out whenever there is a problem. And we do believe that many nations, if you go to Singapore or any of the other countries, they promote their country as a destination for healthcare. Even though we have done it in a very sort of half-dozen and may not be a full-fledged way, we would like to make India the healthcare destination of the world. We have excellent doctors, excellent facilities, and we probably, as Preetha mentioned earlier, deliver the best of healthcare at 5 to 10% of the cost of the world, and are still considered expensive. So I think we should promote ourselves as the healthcare destination of the world. And we, of course, have had a very active session on how to bring in digital health, which is the only way of taking healthcare forwards in our country. These are the few issues that we did bring up this morning. Also, we have also brought up to the government some of the issues facing the healthcare, the pricing, GST, minimum wages, price caps, so on and so forth. But I think these are not insurmountable. I think with dialogue, everything can be solved, as we have seen in Maharashtra. So I think, we are going to come up with a minimum common program for all of us to work together. But we are very optimistic that the future will be very bright for the healthcare in our country.
Namaste, thank you all for being here. We consider ourselves the voice of healthcare, but I think all of you are the voice of India. So to get the right message across is extremely important. Healthcare today is really at an inflection point. If we do everything well and if we come together well, especially some of the sessions which we saw, the one on digital was brilliant. And Sangeeta Reddy, who is, she's my sister, but two of the points which really struck me is that India as a country, we are far more digitally advanced because of our 4G, soon 5G, than many of the countries globally, and we're not using it enough. the mind power of India, the clinicians, the capabilities, not used now. The largest English-speaking population in this part of the world. So for skilling, for manpower, we have the best. So really we have so much in our country, and what we worry about is, is healthcare accessible to a large population? We have to make it accessible. Are there costs involved? If we can really do all that which we have to do intelligently, there is enough revenue, there is enough finance in the system to see that every person, every human being, every Indian gets high quality healthcare. But I think for that, both the government and the private sector have to work together. For a long time, there's been a bit of a divide between the government and the private sector, public sector versus private sector. But at the end of the day, we have to provide healthcare for our nation. Ayushman Bharat in a way was one of the biggest, largest, strongest binding forces. Because when you want to give health out to so many Indians, so much population, you actually need the private sector also. So I think because of Ayushman Bharat, there's a change in our attitude that actually the government and private sector has just started working together, which I think is a fantastic move. But more than anything else, we need a world-class brand for India, and that we have to give high quality, good outcomes so that the rest of the world looks at India. There's potential for people from other countries to come to India for healthcare. We just have to do more about it. Investment is important into healthcare to really grow the infrastructure, and I think the government is considering helping the healthcare sector. So we're looking forward to that. And the other most important point which NATHEALTH is putting forward is that there is the CSR funds, corporate social responsibility, large corporates, small corporates, everybody is trying to use a percentage of our profits to do something back for the country, for society, for people. Can we use it for healthcare? And especially in two areas. One is in the area of skilling and education and knowledge. And secondly is in the area where we can keep people healthy, because preventive health is the most important. We should not find disease when it's too late. Is there a methodology to really catch disease early, educate people on early detection and prevention? And I think the corporate social responsibility, the fact that those budgets can be used for health, it's so important, and it's really a way forward. And NATHEALTH is giving many ideas, thoughts, plans to corporates who come to us to do it, which is a fantastic foot forward. And of course, the digital. The thing about digital is it's never enough what we can do, because the potential is so huge. So I think we've taken a giant leap in the right direction, and we will continue to do it. But thank you all for your support, and it's been a wonderful conference. We have to congratulate the NATHEALTH team, the DG and his team for putting together, and more than anything else, the knowledge in what we've gained, the kind of people who came part of this conference has been wonderful. So thank you.
Thank you very much. I think a lot has already been said, and I would thank you all for being here and participating in this conference, which is unprecedented in the fact that, generally healthcare has been fragmented, but here we've been able to bring CII, FICCI, ASSOCHAM, AHPI, all different groups under one fold. And as has been said, unless we are cohesive, unless we collaborate with each other, it's not just public-private partnership, but private-private partnership is also equally important. So PPP for me stands not only for public-private, but also private-private. And if we were to pool all our resources, it's only then that we can achieve this huge target that the government has set for itself of providing inpatient healthcare to over 50 crore population which was never covered, and also to open 1.5 lakh new health and wellness centers which will focus on preventing disease and also at early diagnosis. Earlier the diagnosis, better the cure. All stakeholders of the healthcare industry are here working closely with the NITI Aayog, the Ministry of Health, NHA, and it's only when we work together that this task will be achieved. What we would require, since you are looking at the healthcare industry from the outside, there are many things, right or wrong, that you may be able to see, which we cannot. So I would encourage you to ask the right questions, and we assure you that we'll try to give honest answers to the best of our ability and knowledge. Because ultimately, providing universal healthcare is a huge task, and no one can do it on one's own. We also have, these startups which will present for the whole day tomorrow. Newer innovations, newer thought processes, because ultimately answers for our health problems cannot come from the West or from outside. They have to come from within our own country by our own innovators. We have a brilliant set of engineers, scientists, doctors, other healthcare professionals, and really the aim of this two-day summit is to find those answers, to find that common denominator which can take us forward and take us to the path where we can find both financially viable as well as clinically viable solutions for healthcare delivery as envisaged in PMJY and Ayushman Bharat. And as Dr. Paul said today, it's not just 40% of the population, but probably 65% of the population that is going to be covered under this or a similar insurance scheme. And it may take years. We also have investors who are attending this conference in full force, because we all know that without money, nothing is going to happen. Once investors are willing to put in their money, that's when, at the same time as Ms. Preetha said, skilling. We have a dearth of manpower, and all of those things would need to come together, and it would still take several years before we start, reaching our goal. But probably this summit should be the start when all facets of the industry have come together, along with government, to achieve this goal. Thank you all very much for being here, and continue to participate in this two-day conference.
Would we shoot the questions? Oh,
Just one last one. I think this is probably the only platform where you have not just the entire ecosystem of healthcare, the providers, the med device, med technology companies, the diagnostic providers, diagnostic companies, investors, startups, as well as elder care companies. So the entire spectrum of healthcare is present under one roof in this conference. And I think if I were to just cite a book for some of the references that you could go through, there's this book called The Creative Destruction of Medicine by Eric Topol. This book was published a couple of years back. And I viewed Eric live in a conference where he talked about how primary and secondary healthcare is going to go digital. This was almost about 8 years back, where he showed the concept of a ICU on a patient's hand, where the patient is at home, and that being relayed to a central, I would say, server or center where the doctor could have a look and constantly monitor. And I think today what we saw in the digital exhibition that was shown by TCS was exactly a part replica of how this could be done. So I think India is, I would say, right on the digital platform. We are on the right track on this front. The only area where we think is the government and the industry has to come together on several regulations that needs to be kind of worked cohesively to create a better future for our patients.
All of the NATHEALTH speakers I heard went gaga over Ayushman Bharat. But as I know, private sector is still very reluctant to join. Were you playing to the gallery by going gaga over Ayushman Bharat? All issues are settled, or you are looking forward to solution of issues?
I think you have asked a very good question and a very interesting question. I'm sure this is running in the minds of a lot of people on both sides of the table. But the honest answer is, I think this is a great concept. I think for the first time, someone has come forward with a universal health coverage scheme for the large section of the country, much more than the population of Europe and the US. So I think we should laud this scheme as a brilliant scheme, something that was a need of the hour. We may have some wrinkles in the scheme which we need to get ironed out. And I think that is the need for dialogue between the government and us. And I think even though PMJY payments have been an issue, the pricing has been an issue, I think there is scope for dialogue and improvement. And most of us, many of us have accepted PMJY in some select hospitals of ours, especially the university teaching hospitals, so on and so forth. So I think we were not playing the gallery. I think we are being honest that it's a great scheme. Nothing is ideal, but we have to work on this scheme to make it ideal over a period of time.
What is progress on package rates? That was my question.
That you will probably have to ask the government, but we have given our suggestions.
Any improvement? Dr. Paul was saying that much has improved on the prices.
I believe there has been some improvements, but they are still working in the process. And as the government did mention today, I think some of this we will probably know after the budget that's upcoming in the next couple of months.
I was in Kaho is the body you might have heard. They said if the prices are not improved, then we would be compelled to cut corners. The quality could be compromised. The pricing is not improved. Do you think so?
Sir, I don't think, anyone who comes to a hospital is entitled to good quality care. There is no two ways about it. Otherwise, why should we be doing this?
Hold on, I'm not talking about...
No. I mean, I'm speaking on behalf of the industry, not a Polo here. And nobody should cut corners to provide health care. And that is why we are asking for better pricing and better costs. Some areas there has been, I cannot tell you specific areas because I don't have the data, but I know that some areas they have considered, and I think that going forward they will. The line of thinking, what we have been told as hospital providers is that if you have a certification, if you have a JCI or an NABH or any quality certification, they might consider better pricing. So it answers your earlier point that everything is based. So if you are a quality organization, you're entitled to better pricing. And a lot of government hospitals, by the way, are going in for NABH. So you will see the standard really going up in the country. It's just that it takes time. It's only 14 months. And pricing will depend on what the outcomes are, and which is the global way it's done, whether it's NHS or whether it is Medicare in the US or Medicaid in Singapore. Everything is outcome based, and we are moving towards that, so I think we're in a good place.
If the private hospital are not satisfied with the government package rate under Ayushman Bharat, how they are bridging the gap between loss and profit?
I think the question is if the pricing of Ayushman Bharat is very different from the private sector, will the private sector embrace it, is it? See, I think what the private sector has done in the past, and I'm sure will continue to do in the future, is that we do have a two-tier system of billing of patients. There are patients who can afford it and who are not part of the scheme. Certainly, there will be a cross-subsidy between the patients who can afford medical care, which is happening even today. We have a lot of schemes from the states and other areas where the pricing is quite low, but those patients are taken care of with equal quality in the private sector, and to some extent they are subsidized by the paying patients who are willing and able to pay for the services. So I think something of a similar situation would probably come in as and when we have many more hospitals accept Ayushman Bharat.
So the question is addressed to all of you, but I want Preetha Reddy to answer, because she said about the CSR funding and all. So like India is now, it's becoming a center of diseases. We've done the pulse polio campaigns, and now we've got diabetes. So we're standing on the, we're on the immediate edge when it's a threat to the larger
The diabetes capital of the world already.
Yeah, exactly. So therefore I said that's a matter of concern. Then when we see children being diagnosed with cancer across the country, and then breast cancer. So how do you want to take this on a war footing? Means you can't leave it for Ayushman, or you can't leave it for Kejriwal in Delhi. So how are you people are the guys who are managing the Health Federation?
I can, but Dr. Mahajan's done a lot of work on this.
I think we in our own small way in different organizations are trying to meet the challenge. But it has been also taken care in this Ayushman Bharat scheme, in that 1.5 lakh health and wellness centers are being set up, out of which about 20,000 centers have already come into play. So the crux lies in prevention, which Dr. Paul talked about, primary and secondary prevention, and in early diagnosis. And that can be done through these 150,000 HCWs, where if you diagnose diabetes early and start treatment early, if you diagnose hypertension early, if through, we are thinking of schemes as to how to pick up breast cancer early. If that is done early, then it can be cured. And not only is prevention better than cure, but prevention is also cheaper than cure. We don't have the money if such a huge number of diseased patients are going to come into the fore who have advanced disease. There is no way, even in the US, with the trillions of dollars they spend on healthcare, 18% of their GDP is spent on healthcare, yet there are 40 million Americans who are uninsured, who have no healthcare facility. So in our country, to think that we'll be able to do it. So I think the health and wellness clinics are really the correct method. How we will actually man them, how we will get the skilled manpower to run them are challenges which all of us have to think of and meet. But it's not as if the government hasn't thought about it. The scheme has thought about it. As you know, it's in two parts. One is prevention, and the other is the Ayushman Bharat part, where it is inpatient treatment. So, and we have to work together because the reach, the PHCs, are very defunct. The CHCs are defunct. The district hospitals are not up to the mark, and that's where probably the private sector will align with the government to provide this. And I think, as Ms. Preetha said, as far as CSR funds go, currently if Apollo wants to use its own CSR funds for, say, doing primary health care or early detection camps in different states, probably they are not permitted. You cannot spend the money, CSR money, in your own field. But for healthcare, probably this will need to change, because only then will money flow into the healthcare